We're going to enter into our second role play. We have a new doctor, and then we have a patient from Mexico.
Hello, I'm Dr. Chang.
I'm Lupita Garcia.
Okay,
Good morning, señorita.
Okay. Okay, thank you for coming today. Do you want to tell me what symptoms you have or what brought you here?
Oh, for the last 10 years, I have had dolor de barriga, pain here in my belly, here.
Okay, so
and
pain.
I have diarrhea. I have to go very frequent to the bathroom, and it's liquid. And I am inflamada. Inflamada,
What does that mean? No, I don't.
Inflamada.
Uh-huh.
I don't know, inflamada,
Okay, so are you talking about that you feel full or bloated?
I don't know what this is, but I feel like pregnant,
Okay,
like pregnant.
so you're distended.
Uh-huh.
I see, okay.
Okay.
What other symptoms do you have?
This is my problem. You know that I came here 6 months ago, and since then I start feeling worse and worse, and this is why I am here.
Okay, so you said that you've had symptoms for how long?
10 years.
10 years, but you fit that they're worse over the past 6 months.
Yes.
Do you have any idea why that might be?
I don't know, but I suppose that is related to the food, because I used to eat frijoles, beans, and tacos in Mexico, but now here I have to eat hamburgers and fries, and it's horrible for me.
Well, that's a little unusual because most people say that eating beans and that type of food is actually makes symptoms worse. So it's a little atypical that you had symptoms and you feel it's worse when you're not eating those types of foods, although hamburgers could be bad too. But okay, so is there anything else that you think might be related to worsening symptoms?
I don't know. I think that it may be an amoeba, a parasite. It's very common there in Mexico.
Okay. Well, thank you for bringing your records, and I did look over some of the tests that were done, including ones that you had here in the United States, and basically the tests that you had looking at your stool when you had a bowel movement were negative for infection. They were normal. Mm-hmm. So there really is no evidence that you have an infection. So I don't think that's explaining your symptoms.
It may be a family problem because my mother have the same symptoms.
Okay, and does your mother, what does your mother have? What do you think that is?
The same, diarrhea and pain.
Okay. Is there any other symptoms that you have, or how have you been treating your symptoms after all this time?
I am really very nervous because I think that it could be a cancer.
A cancer? Well, that's a valid concern, although you did have a study where they looked in your bowels and there was no cancer, so I don't think that's causing your symptoms.
Thanks God. Gracias.
And how have you been treating your symptoms, though, all this time?
Sorry?
How have you been, what medicines or what things have you been doing to make your symptoms better?
Yes, I had Imodium sometimes.
Okay.
And Flagyl, for the amoebas.
Is that an antibiotic? Is that what you meant to say? Flagyl?
So. Yes.
I see.
And the curandero gave me some herbal medicines.
Oh, who's that?
The curandero is like a doctor, but it's not a doctor.
It's not really a doctor?
Uh-huh.
Okay, so some kind of healthcare provider, some type of person that gives you, heals your condition. And what did this person give you?
Herbal medicine.
Herbal medicine. And what did that do for your symptoms?
At the beginning was great, but then the diarrhea start again.
Yeah, there's really not great evidence scientifically that there is some that herbal medicines can help, but many, we don't have any really good data that it's that effective, so I'm not sure that that's really going to help your symptoms. It sounds like you had a plus-minus response to it. We do have medicines that we could talk about after it looks like you have most of your evaluation, but we should do a physical exam. And then we could talk again about what we think you might have and then maybe what treatments are available.
Mm-hmm. Yes, I need something because I have to work. I have to get money to my family, and it's difficult with the diarrhea.
Yeah, I understand.
I'm curious to know what you noticed specifically on how culture might have made this interaction different. And we have very expert mic passers now. In order to pass mics here, you have to have an MD. So, what'd you notice in this interaction? Over here? Do you all want to come move up? Yeah. Come move up. Do you want to join us? She doesn't want to. Okay, great.
I thought the physician was very negative in the way she responded, and kind of probably made the patient feel as if she was the only person with this disorder, particularly talking about the food.
Right, connecting to your colleague's point.
It does, right.
And also, were there other examples where she was negative? She was negative around the food. She was negative around... There were some other things, yeah. The herbal medicine. Yeah, sure. Wonderful point. So she wasn't open around, specifically around a lot of the unique cultural ideas. Please.
She was speaking about her new life the last few months, but the physician doesn't ask her about it, a word. She said that she's working hard now, she needs the money, and there was no response to this information.
Right. The symptoms had changed in recent times, and the physician wasn't seeking out
to the hamburger.
Only the hamburger, right.
Only the hamburger.
I think you can't blame her. When this patient started talking, she didn't stop talking. From the very beginning, she was very irritating. A lot of information, a lot of data, confusing, mixed Spanish words with English. I think I can't blame the doctor that she was, little spectacle.
Okay.
I think she did her best.
Doctor thinks she did her best?
Yes.
Great, I feel the same. But I do want to underscore that we're also dealing with a language barrier here.
That's the situation here is a very typical situation in our clinics. And I think every time I'm thinking that if she won't stop talking, I will jump from the window outside. Because listen, she reacted, I think, very efficiently. She was patient enough, and I think she was great.
Great. Okay, so we have some ideas that the doctor was doing the very best that they can, right? I also just want to note, we're going to go over here in just one sec. I just want to kind of mark something that, he says, in my experience, sometimes, this is very typical, I just want to jump from the window. So I also want to acknowledge that sometimes patients can bring up emotions in doctors. Example here that caused her to be negative, and I kind of want to mark that emotions exist in doctors as well. Back here. Oh, I'm sorry, I just trumped you. We'll come right back. Oh, you were just holding, okay. Good. Sir.
I have a quick question. I'd like to ask the question of the doctor and answer it in role, okay?
Yes.
In role, was this patient more difficult to deal with because she was from Mexico compared to someone who would be a white American? Or, is that, if you found this patient difficult, is that what made it difficult? Or was this the kind of the run-of-the-mill, difficult, functional patient?
Yeah, actually, for me, this wouldn't be difficult, but
but
in the role,
we're talking about in role.
Yeah, I think the issue that I would, as a physician, I would have is that I didn't understand the language and the terminology, and I wasn't sure that I was interpreting her correctly, and I also wasn't sure of what the cultural beliefs would be, and also what the infection. That there's certain beliefs about what causes their symptoms. Just not being familiar with that I would feel kind of intimidated, I wouldn't know exactly how to ask that or get around that. I wouldn't be comfortable with that.
Okay.
I think Lynn beautifully played a role of the scientific model. No values, no interaction, nothing.
Great.
It's just a computer-like asking questions.
That's how I work.
Kind of model, kind of the model of the scientific doctor, the objective doctor, trying to remain objective.
Here.
Symptoms, diagnosis, treatment. It's a wonderful observation. Other observations, maybe just kind of examining specifically this patient's culture and how that might have impacted the interaction. Great. Great. So we have over here. Go ahead.
The spiritual doctor, just like just like with the Nigerian patient.
Right.
It was
And she used a word. What word did she use? Curandero, right? And like a chaman, like a shaman. Sure. So again, recognizing that alternative medicine might be playing a role here. And again, jumping back to this gentleman's point, what was the doctor's reaction to that? Nonsense. Shut it down, which might have had an impact on the patient.
The religion. I mean, she was very happy when she heard that she didn't have cancer, and she, we say it persinarse, I don't know how you say that in English.
Crossed herself?
Yeah.
Yeah.
Yeah. Yeah, and well, there are some issues in the practice in Mexico and Latin America. And I think I mentioned that this morning. For example, they gave her a Flagyl, which is an antibiotic for amoebas, because there's a belief that always when you have diarrhea, you have amoebas, although it's very, very infrequent. And I may want to point out something. Even the researchers who do research in amoebiasis are getting a very hard time finding patients with amoebas nowadays in Mexico.
And so there's a lot of misdiagnosis and overprescription of antibiotics. I want to check in with our patient. Lupita, how was that interaction with the doctor for you?
I think she was kind, but at the beginning, I felt that she was angry because I called her a señorita. Señorita. And
so she seemed to have a reaction to that.
Yes.
And I'm going to go back to this gentleman's model, Doctor Enroll. How did that make you? How did that make you feel when she said señorita?
I didn't really like that.
Yeah.
Yeah. I didn't know why she was calling me that. I just told her what my name was.
Okay. So we're going to hang on to that point as well. Anything else you noticed about the...
That now I am not nervous because I know that I have an infection and cancer. That is the most important for me.
Wonderful. So let's transition into what suggestions, besides jumping from a window, she could jump from the window, but... She
calls her señorita. She's very irritating.
Very irritating, right. So one solution is to get her out of the office, or to get yourself out of the office. But if we don't exit the office and refer her out, what might some solutions be that we might improve Dr. Chang? Enroll Dr. Chang. What are some suggestions?
Recognizing difficulty in communication. Trying to facilitate the communication, recognizing that there are communication issues as far as language is concerned.
Acknowledging the language barrier, having a little extra patience around that, trying to help her out with words. Is this what you mean? Kind of some of our active listening techniques in terms of echoing back and asking questions. Great. Other suggestions?
May I clarify something about the señorita?
Mm-hmm.
Sure.
In Latin American countries, especially in lower socioeconomical levels, they will call women physicians señorita, because although they will accept them as health care providers, they don't. I mean, it's difficult for them to understand that women can be physicians. So that's why they call them señoritas.
And I'm actually hearing a solution in that if doctors can heighten their awareness around some of these cultural differences and know in advance that señorita is not a pejorative, it's not a negative, it's a culturalism. I remember from my teaching days, people used to just call me Mr. And I'd be like, I have a name, but that's what they call their teachers, So just kind of heightening your cultural awareness around that, which would, again, help you manage the emotions in that situation. Any other suggestions before we watch Dr. Chang again? Great.